My fellow Guyanese, welcome to today's briefing. During last week, we focused on the males in our society, and we do hope that everyone understood the importance of the message and that we will see a decline in the number of positive cases. For this week, we are going to be focusing on our hinterland regions, recognizing that they all have bordering communities as well as mining communities that make them vulnerable for cases to be imported. As of today, 3 of the 4 hinterland regions are affected. I wish to draw your attention particularly to region number 7, Cuyuni-Mazaruni, where 7 positive cases have been identified. Most of these cases coming from the mining community. We are concerned, particularly because other mining communities can be affected, since our miners can transport this disease from the coastland into the interior. We recognize that our efforts in limiting the spread of this disease are dependent on this community coming fully on board with the regional health authorities as well as all other entities who have joined in fighting this disease. The map that you see on the screen presents the distribution of the positive cases in the 10 administrative regions. Note, the epicenter remains region number 4, specifically Georgetown, our capital, closely followed by region number 3 and region number 10. It must be highlighted that even with the curfew in effect, we have witnessed a spike in the number of cases. Today, we have with us Dr. Nail Utman, Regional Health Officer, Upper Takatu, Upper Essequibo, Region number 9. Dr. Utman.
My name is Dr. Nail Utman, Regional Health Officer for Region 9. As we all know, Brazil is now the epicenter for coronavirus in the South Americas and in this part of the region, including the Caribbean. This is of obvious importance for us here in Region 9 since we share borders with Brazil. We started preparation for coronavirus in February when we did our first training session here in Lethem. Since then, we have been able to conduct 7 such training sessions in all of the districts, namely Lethem, Caraçabay, Anai, Aishalton, and Sand Creek, respectively. Our doctors, nurses, and other health staff are now tasked with the responsibility of training the other persons from the districts so that they can be informed as well. We have established a regional task force to deal with everything COVID-19. This task force meets every week to discuss all of the issues pertaining to border crossing, resources for coronavirus, suspected cases, etc. Dissemination of information has been paramount. We have been able thus far to utilize Radio Lethem, Radio Aishalton, Radio Anai, hard copies that we've distributed to our health staff and residents of Region 9. We have also been able to utilize social media in getting some of the information out. Our regional hotlines, we have established those. One such number that persons can call and get information pertaining to coronavirus is 695-6681. We have 5 screening sites. These screening sites are at the Lethem Hospital, Aishalton Hospital, Sand Creek Health Center, Caraçabay Health Center, and Anai Health Center, respectively. On a daily basis, persons traversing our facilities can and will be screened at these facilities. Sample collection. We also do sample collection on all of these sites. However, thus far we have been able to collect samples in Anai, in Caraçabay, and in Lethem, respectively. We have established quarantine facilities in Lethem and an isolation room to cater for positive cases and unsuspected cases. We have thus far had only one suspect, one confirmed case, and that was an imported case from Brazil. Border patrols is of importance to us. This is one of our major challenges. We have over 1,000 miles of border in Region 9. Our police force and our Guyana Defense Force have been collaborating in monitoring some of these borders and ensuring that residents do not cross either side illegally. Community participation has been paramount for us. We have had Tushas and other village leaders assisting in this whole coronavirus fight. They've been able thus far to set up some checkpoints in their various villages to disseminate information and to assist us in monitoring the border, ensuring that persons do not cross. Obviously, we have some challenges with this, but we will continue to work to ensure that at least if persons pass, we will be able to quarantine them. Surveillance, we have been able thus far, along with the villagers, to do surveillance to identify our primary and secondary contacts, utilizing not only the health staff but residents from the different villages. Sanitization has been very important. As we know, on Thursdays, every Thursdays, we sanitize goods and services coming from Brazil to Latam to ensure that whatever is on this side of the border is safe for our residents to utilize. Please continue to follow the health advisories. Please continue to adhere to the curfew. And we ask you to do your part and assist us in assisting you to fight this coronavirus. Thank you very much.
Thank you, Dr. Utman. Now for the global report. Globally, the statistics according to WHO are as follows. Total number of cases is 5,204,508, with 337,687 deaths. In the region of the Americas, the total number of cases is 2,338,124, with 138,116 deaths. The situation in Guyana is as follows. As of today, we have another death, bringing our total number of deaths to 11. Of the 32 tests done today, there are 2 new cases. So, the number of confirmed cases is now 137. To date, the total number of persons tested is 1,489, with the total number of negative cases being 1,352. We currently have 62 persons who have recovered, 64 active cases in institutional isolation, 2 patients in the COVID ICU, and 2 persons in institutional quarantine. My fellow Guyanese, today we are on the eve of another independence celebration. Guyana, our beautiful country, is celebrating 54 years as an independent nation under the theme Celebrating Through the Lens of Resilience, Innovation and Sustainability. As we look through those lenses on 54 years of development, let us use this opportunity to reflect on our strengths and let this guide the path we take as we move this nation forward. Health-wise, let us come together as a resilient nation to win this fight against COVID-19. Tomorrow is a holiday. Let us remember that celebration now has a new meaning. It now means spending quality time with our families at home and avoiding the outdoor gatherings that we once engaged in. I wish to leave with you the last stanza of our national anthem. Dear land of Guyana, to you will we give our homage, our service, each day that we live. God guard you, great mother, and make us to be more worthy our heritage, land of the free. Thank you, and may God bless us all.